you start with physical examination. Start with introduce yourself to patient. Briefly explain the examination that you will do, and gain consent from patient. Start the examination with proper exposure of the limbs, and take note of any external rotation, muscle wasting, scars, fasciculations, or foot drop. Check for muscle tone in each joint. What you are looking for are presence of foot drop, floppy foot, rigidity, or spasticity. Ask the patient to flex the thigh, with the leg flexed at knee and hip, and push against resistance. In patient with MRC grading 2/5 and below, ask patient to lie on his side. Ask the patient to flex the thigh, with the leg flexed at knee and hip. Iliopsoas muscle is innervated by femoral nerve. Root value of L1, L2, and L3. With the leg flexed at knee and hip, ask patient to extend the knee, and push against resistance. In patient with MRC grading of 2/5, ask patient to lie on his side, with leg flexed at thigh and knee. Then, ask the patient to extend the knee. Quadriceps femoris was applied by femoral nerve, with root value, L2, L3 and L4. Ask the patient to flex the knee, against resistance, while the hip is flexed. The patient, lie prone. Ask to flexing the leg, at knee against resistance. Patient with MRC grading 2/5 and below. Ask patient to lie on his side, and flex the knee. The hamstrings muscle were innervated by sciatic nerve. Root value, L5, S1 and S2. Ask the patient to pull the leg inwards, towards the center of body. In patient with MRC grading 2/5 and below, ask patient to lie on his side. With your hand as support, ask the patient to push down the leg. The adductors were supplied by obturator nerve. Root value, L2, L3, and L4. Ask the patient to push the leg sideways, and outwards against resistance. Alternatively, ask the patient to lie sideways, and lift up the leg, against resistance. The gluteus medius and minimus were innervated by superior gluteal nerve. Root value of L4, L5, and S1. Patient lie prone. Have the patient to push his leg backwards at the hip joint against resistance. In patient with MRC grading 2/5, ask patient to lie on his side. Instruct patient to push the leg backward. The gluteus maximus were innervated by inferior gluteal nerve. Root value, L5, S1, and S2. Ask the patient to extend his foot upwards, towards the body, and push against your hand. The tibialis anterior muscle was supplied by deep peroneal nerve. Root value, L4 and L5. Ask the patient to push his toes upward, against resistance. Ask the patient to extend his big toes upwards, against your finger. The muscle extensor digitorum longus, brevis, and extensor hallucis longus were supplied by deep peroneal nerve. Root value L5 and S1. Ask the patient to push his foot downwards, and press on your hand, while the leg is kept straight. Gastrocnemius muscle, innervated by tibial nerve. Root value, S1 and S2. Ask the patient to flex the toes, downwards against your finger. The flexor digitorum longus and flexor hallucis longus were supplied by tibial nerve. Root value, L5, S1, and S2. Ask the patient to rotate the foot inwards, against resistance. Tibialis posterior muscle supplied by tibial nerve. Root value, L4 and L5. Ask the patient to rotate the foot outwards against resistance. The peroneus longus and brevis muscle were innervated by superficial peroneal nerve. Root value, L5 and S1. Ask patient to cup the sole of the foot. Small muscles of sole were supplied by the medial and lateral plantar nerve. Root value, S1 and S2. O'Sullivan grade can be used to score the muscle tone. Muscle spasticity can be graded using modified Ashworth scale. Muscle strength can be graded using modified MRC grading scale. Ranging from grade 5, which demonstrates normal muscle strength, to 0, no muscle contraction. With the lower leg hanging freely off the edge of the bench, the knee jerk is tested by striking the quadriceps tendon directly with the tendon hammer. Repeat and compare to the other leg. The knee jerk reflex is mediated by the L3 and L4 nerve roots, mainly L4. The ankle reflex is elicited by holding the relaxed foot with one hand, and striking the Achilles tendon with the hammer, and noting plantar flexion. Compare to the other foot. The ankle jerk reflex is mediated by the S1 nerve root. The deep tendon reflex can be graded as such. Examination of lumbar plexus must be complete with examination of sensation. There are multiple types of sensation that need to be examined. Pain, temperature, vibration, two-point disc, kinesthesia, proprioception, and stereognosis. The finding then need to be charted and relate with the dermatome level. Sensory grading, ASHA, can be used to score the sensory finding.